Hi, my name is Petronilla. I am glad you made it to be here. Welcome to my channel. Today I'm going to be talking about some aspects of writing or some documents that are important for a nurse practitioner student. These are the things that you come across in your course as you study to be a nurse practitioner. One of them is going to be a SOAP note. The other one is going to be how to approach the OSCE. So for now, I will talk about the SOAP note. So what is a SOAP note to start with? A SOAP note simply is, the word SOAP is an abbreviation of the word subjective, objective, assessment, and plan. That's what SOAP means. So what's a SOAP note? It is a note or document in which you put together all the aspects of the subjective information, objective information, the assessment that you make as a nurse practitioner, and the plan that you have for your patient. So what does the SOAP note consist of? First and foremost, there is the S. S stands for subjective. In the subjective part, you will include anything that the patient tells you. First, there is a patient name. You usually ask them, what's your name? What's your date of birth? So you include that. Then from there, you will include their age, their gender. You already have the date of birth, so you can put their age, a 67-year-old female, and gender. Then from there, you talk about the chief complaint. What brings the patient in today to the office, to your office as a nurse practitioner? Is it a cough? If it's a cough, it's for how many days, or how many days have they had this cough? So it can be, a chief complaint can be something as simple as cough times 4 days, cough times 2 months, for example, for people who use ACE inhibitors. Then from there, you will look at the history of present illness. Usually we use old cards to come up with a history of present illness. Besides the old cards, you can include stuff, something like circumstances under which the patient started feeling what they are feeling when they started developing the symptoms. Were they sweeping the compound that they started wheezing? Were they hiking somewhere on the mountains, then because of the cold they started wheezing? Or was somebody lifting some weights when they started developing joint pain? You need to find out what was going on. The other thing is, for example, do the patients have other sick contacts? Like in situations where we have infectious disease, like talk about upper respiratory infections, a cold, a cough. Does the patient have other contacts that are sick? It's easier for you to decide whether somebody has maybe a cold because they were interacting with children who were sick. You need to find out the circumstances surrounding their sickness. Does the patient also have previous episodes of similar signs and symptoms? Have they experienced this before? For example, has the patient had this kind of cough before? If they had, what was going on? What helped the cough? Then also other associated symptoms that are coming or that come together with whatever the patient is feeling. All that you will gather under the subjective information. This is a situation where you collect patient history thoroughly. You ask the patient questions. This is more important than anything else because by asking questions, you can reach a diagnosis. It's very easy to do that only if you're able to nail the questions that will help guide your diagnosis. So history taking is what actually makes up the subjective part of a SOAP note. Then from there, we go to a review of systems. When you talk about the review of systems, we normally will handle 3 body systems that are related to or affected. So deal with one body system that is affected by the illness. For example, if it's a cough, we know the cough affects the respiratory system. So you will assess that. The other thing, you will ask questions. Under this subjective part, you will ask questions regarding the respiratory system. Are you being short of breath? Are you coughing? Do you have any problems breathing? Have you been wheezing? So whatever pertains to that system. But then we also do a minimum of 2 other systems, one above the system that is affected by the disease and one below the system that is affected by the disease. For example, you have a cough. We know it affects the respiratory system. You can assess also the HENT. That is the head, eyes, ears, nose, and throat. Often we know that a cough will also go with this anyway. It might have a situation that affects all those other parts. Then from there you look at the abdomen. Why the abdomen? Because it is the system that is below your chest. But the other system that is mandatory, we have usually 2 mandatory systems that need to be checked because we never want to miss them. That is the respiratory system and the cardiovascular system. You don't want to miss any symptom that could mean a patient has a heart problem or a breathing problem. Based on our ABCs, we know we never want to miss that. So in your assessment or your history taking, make sure you're asking questions about the body system that is affected, the respiratory system, the cardiovascular system, and if somehow they fall in between the upper and the lower, you are safe. If not, then include one more system that is lower or above. So have a system that is affected, a system above and one below, but make sure in those systems there is also respiratory and cardiovascular. Those 2 must be part of the assessment. So you might even end up doing 5 systems anyway, or even 6, depending on what other symptoms the patient has or the differential diagnosis that can help you determine what the patient has. Then from there, we have under the review of systems in the subjective, there's one thing that usually gives people problems, that is the constitutional or the general assessment. This one, you ask questions like, have you been febrile? You look at fever, you look at fatigue, you look at weight loss. Have you lost any weight in the last few days or months? Alertness, how alert is the person? Has your level of consciousness changed in any way? You assess whether the person has had any changes to things that appertain to their general well-being. So there's a lot more to subjective information. You look at the family history, the religious preferences of this patient, social history, which includes the smoking, alcohol, drug use, living situation, support systems, family, like family or friends or church, ability to do the activities of daily living. How comfortable are these people? Do they have a house to live in or they are homeless? You also look at their surgical history. You also find out whether they have allergies. You ask questions about the past medical history, especially diabetes, hypertension. You don't want to miss those. Family cancer, breast cancer, and things like that. And most importantly, also, don't forget to ask about the immunizations that the patient has had. Are they up to date with their immunizations? So that makes the first part of the SOAP. And I'm going to be looking at the second part, which is the objective part of the SOAP, to the end of it in my next video. So don't forget to join me in my next video for the next part of the SOAP. Like and subscribe in order to get more to get notifications of my next videos. Thank you so much for being with me. I appreciate you all. Thank you.